Two, test, test, test. We'll just hold it. Test, 1, 2, better? Okay. Ready? Okay. Well, good evening. Thank you all for coming tonight. We'll have updates, much like last night, updates on the confirmed corona cases that we have here in Lubbock and the city's measures, and then we'll open it up for questions from media members. But first, we have Director of Public Health, Catherine Wells.
Good evening, everybody. I've provided to everybody this evening our update on case investigations, and this is the format that we plan to use moving forward. It will also be updated on our website. But we will be listing case information for each case that is confirmed here in Lubbock with the person's report date, age, exposure, and then the status of that investigation. Yesterday we completed the investigations on our first two cases, and those are the ones that we discussed in detail at the press conference last night. We have delivered control orders to individuals, so that requires them to monitor or remain in their residence and continue to monitor. And that is one of the steps that we will take if individuals who are under investigation are out in the community. We want to take this seriously. We need individuals to stay in their homes if they're sick or if they're under monitoring by the health department. We've also had the report yesterday evening, about 5 minutes prior to the press conference starting, of an additional case. That case is case number 3. Our investigation today shows that that individual traveled outside of the country, and that is where we believe the individual contracted COVID-19. With that individual, we're concerned about any exposures after March 12th, and that's the date of symptom onset. We're really not worried about exposures prior to symptoms. We have provided all of the healthcare providers that have been in contact with this individual have been notified, and we allow the healthcare facilities to make those contact notifications through their infection control. We have also notified the majority of the close contacts, and we will also be re-interviewing this individual tomorrow morning, and if we determine any additional public exposures, those will be listed on this updated report. And I'm now going to turn this over to Dr. Klepper. Oh, sorry, I was also there's also a second page on this report, and I wanted to explain it to the media briefly. We've had a lot of questions out there about some of the public health terms we're using to monitor individuals, and I really wanted to take an opportunity to try to define what we mean when we say somebody is high, medium, or low risk. A high-risk individual is someone that has been in very close contact with somebody who has COVID-19, and that person hasn't been using appropriate protective equipment. So someone that didn't have a mask, or they were all in the same household, so there's really a potential for exposure, and that's what we consider a high-risk individual. Those individuals are required to have daily contact with the health department. They are also restricted to their home, and they are also required to call us if they develop any of their symptoms. A medium contact would be somebody who's been in close contact with somebody with COVID-19, but appropriate infection control measures such as a mask have been used. And that person is on what we call self-monitoring, where they take their temperature daily and watch for signs and symptoms. We recommend that they remain in their home or a comparable setting. And then we also encourage them to practice social distancing, and social distancing is something we encourage for everybody, but we definitely, when we talk to these individuals, we're stressing the importance of social distancing. And then the last level is a low risk category, and that is really someone who's been in the same indoor environment as a person with COVID-19, but it's not for a prolonged prolonged period, so they don't meet those higher level contacts. And those individuals are really need to do the social distancing, and then if they become sick, they need to stay at home, and if they have severe symptoms, they need to seek medical attention. And I hope that will clear up some of what we're saying when we talk about high, medium, and low risk of different individuals in the community. I'm now going to pass this on to Dr. Klepper, who's stepping in for Dr. Cook this evening to talk a little bit with you.
Thank you, Catherine. Yes, sure. My name is Douglas Klepper. As a medical provider and as a pediatrician, I'm going to discuss 3 items and 3 items of hope. Okay? As a physician, I'm often privy to many people's concerns and anxieties, and today has been that for all of us in the city. And I want to talk about these 3 areas. First of all and foremost, your city is looking out for you. There is no question that the resources that this city has implored is gone above and beyond anything that I've ever experienced in my 30-year career here. Your city is looking out for you, so you need to be hopeful and trust these people. These people are getting the information to you as rapidly and as quickly as possible. They have your best interest at heart. The second person is the medical area that I'm an active part of. We had a wonderful press conference earlier today of factual natures of what this city and the medical community is looking to help you out, to make you feel more secure. Not only to feel secure, but to be secure, because they are making extraordinary efforts that have not been done in other areas of this country, because we're getting out ahead of it. We're not reactionary. We are ahead of it. And the third is as an individual. We all have individual responsibilities, and I'm very hopeful and trustful in the people of Lubbock that we can do the right thing. I was very disheartened I couldn't go to the gym this morning. But what did I do? I got up and I went around the park by myself, waved at people a social distance away and said, "Good morning." And it was very fulfilling to me, so I took advantage of around here. And people can do that all the time. I had a grandmother come to my clinic today, and she says, "You know what? I think we need to revert back to Victorian times." I said, "What do you mean with that?" She said, "Well, you remember back in Victorian times you had these hoop skirts, and those hoop skirts kept you a certain amount of social distance. So if we all considered we were wearing hoop skirts, we'd be our social distance of 6 foot apart. And if we go back and just get past that natural instincts, because you're talking to a hugger here. I've not been able to hug people for days. It's painful and it's against our nature. But think back of a time and take on some interest of being personally responsible with your social distance up with that." With that, I'm going to turn that over to our mayor, who has our best interest at hand.
Thank you, Dr. Klepper. It's you're talking about hoop skirts. I was raised in the Baptist church, and we used to say when we danced that there had to be enough room for Jesus in between you and who you were dancing with, and so it's a little bit that it's probably not quite 7 feet, but I'm fortunate to work with great medical professionals and public health professionals, and I'm thankful for Catherine Wells and for Dr. Klepper and Dr. Cook. We count on them a lot, and we're very thankful for what they've done. I want to comment on a couple of things. I want to start with Governor Abbott's order from today. Many of you may have seen it, and it's important that you realize that it becomes the law of the state. It goes into effect tomorrow night at midnight, and at that point, it would supersede anything that we've put in place. The highlights from his order include, and I'm going to read this because I want to make sure that we get this right, but order number 1 is in accordance with the guidelines from the President and the CDC. Every person in Texas shall avoid social gatherings in groups more than 10 people. Number 2, in accordance with the guidelines from the President and the CDC, people shall avoid eating or drinking at bars, restaurants, and food courts, or visiting gyms or massage parlors, provided, however, that the use of drive-through, pickup, or delivery options is allowed and highly encouraged throughout the limited duration of this executive order. I have no explanation about a drive-through massage parlor. I've never heard of one, but you can figure that out on your own. Order number 3. In accordance with the guidelines from the President of the CDC, people shall not visit nursing homes or retirement or long-term care facilities unless to provide critical assistance. And finally, order number 4, in accordance with the guidelines of the President of the CDC, schools shall temporarily close. Now, this order is good for 2 weeks, so that means it runs through Friday the 3rd of April at the same time at midnight. It goes on to say that, and we want to make sure that we underscore this. This does not mean sheltering in place. You can get out and go to the grocery store. You can go to the gas station. You can go to the park like Dr. Klepper talked about. You can go check on your neighbor. Domestic travel has not been limited in any manner. In fact, we expect, it goes on to talk about that government entities and businesses will continue providing essential services. So that's a relatively wide gap. We have a lot of our businesses that provide essential services. That will continue business as usual. However, they're going to need to comply with the other parts of this as best they can. So and I'm thankful that this has been cleared up for the entire state. I talked to a business owner this morning in the Metroplex, and he has locations in different parts of the Metroplex, and he said that he has employees from 17 different municipalities, and I can't remember how many locations he said he had, but he said that the different municipalities rolling things out in different fashions has caused problems. I can see that being the case. We're asked to do quite a bit of interpretation on this. We're not going to read too much in this. We're going to read, sort of interpret it as it is. We will be required to enforce it, and that's something that we will do. Okay, I want to talk about the health department for just a second. I think we may have briefly mentioned the other night, but we added initially 10 and then another 5 more qualified folks taking calls at the Lubbock Health Department. They're trained members of Lubbock Fire and Rescue, many of them trained EMTs and paramedics. Today we took 360 calls at the health department. That's twice as many as we took yesterday. That number is 775-2933, option 1. We want people to call the health department if they have questions. We prefer you, if you think you have the virus, to call your physician first, your primary care physician first. If they feel like you need to be tested, they will talk to the health department. But if you don't have a primary care physician, or if you think you've been exposed and you have a question and it'll help you sleep better and not go on social media and do some kind of silly posting, then call the health department and let's help you answer your question, all right? We don't need panic, we need facts. And so we're trying to provide for that, and I'm thankful for Catherine and her team. By the way, we also put on 2 new, today we had 2 nurses from Lubbock ISD join us at the health department. They're helping doing investigations, so we're staffing up to meet these demands. One more thing about the health department. Don't show up at the health department and ask to be tested. We don't do testing at the health department, okay? Call the health department. Don't just show up. That's not going to do anybody any good. Okay, before I turn it over to the city manager for some comments about some adjustments that the city is making, I want to comment about the press conference this afternoon. I hope you'll go back, if you didn't have a chance to see it, and watch the press conference. It was very, I think Dr. Klepper mentioned it, it was very well done. It was serious. It was to the point. I'm thankful that Covenant and UMC are both opening testing abilities. UMC's drive-through clinic is up and going as we speak. I'm also thankful for the fact that they've postponed elective surgeries in their facilities and they're focused on the matter at hand. This is very important. Maybe as important as anything is the restrictions that they've put in place about visitors. I think that helps certainly for with patient safety, but it also helps the safety of the men and women that we count on the front lines working at our hospitals. And I hope we'll all respect what they've done. It's unprecedented, as Dr. Klepper mentioned. It includes not only limiting the number of guests, but guests are going to get screened themselves before they can go into those facilities. Let's talk about a press conference for tomorrow. If we don't get a positive test between now and tomorrow, we will not do a press conference tomorrow evening. We very well could do an update on the investigation on case 3, but I would not expect us to come back with a press conference for tomorrow night. So you can just set your expectations based on that. I'd like to invite the city manager to come forward and share with you what we're doing as a city government to adjust in these times of very important times and times where we need to take this very seriously. Mr. Atkinson.
Thank you, Mayor. Follow up a little bit on several announcements that the city made yesterday. So yesterday we sent out announcements. Consisted really of 3 things. Yesterday, business as usual, closed down at 4 o'clock. Same thing today, same thing tomorrow. So as those of y'all came in tonight, you may have seen the big glass door that had been pulled across the hallway. That was the plan. And then the follow-up to that plan was beginning Monday, we would actually close the buildings to the public. That will continue, but our commitment to all the public, to all our customers, we're going to continue to provide our city services. So I'm going to go over a few of those tonight. More detail will follow over the next 2 days. There was more detail that came out today on a few. Basically what we've asked is each of our departments to issue their own unique guidance and instructions to their customers. It'll go to the whole public, but we want to be able to assure we're really targeting the people that work with us. So beginning Monday, what you'll notice, again, the doors will be closed. 3 exceptions to that, 3 exceptions. Number 1 is for this building. So in this building, if you've noticed to your right as you come in, is the office that we call Vital Statistics. That provides certain records to people, and generally those records are needed, and they're needed quickly. 1 window will be open at Vital Statistics. 1 window will be blocked. The window that's open, we've installed a full-length guard. That's to protect both our city staff and our customers. You will be able to transact at that 1 counterpoint in person. But as I'm going to say 2 more times, you can also do that by mail. You can also do that online, so we encourage you to do it that way. But if you can't, or for whatever reason you really need to speak to one of our people, you'll be able to do that there. The second will be over at what we call the Lubbock Business Center, or the Lubbock Power and Light Office, where the City of Lubbock utilities are located. That lobby will be open. It is restricted to only kiosk traffic, so there are self-serve kiosks. And we will have a small number of customer service stations that will be open. We're going to try to start with just 2 of them. We have the capability to do more. But those likewise have also been protected. They have full-length guards across those. The purpose of maintaining those customer service points there is really to help people with getting new utilities started or to do reconnects. Remember, we have suspended disconnects, so we do expect that traffic to drop. You'll be able to use the kiosks. We'll have those limited customer service points. We have drop boxes. We have a drive up. We have online. So there should be plenty of ways to contact them. The phones will remain working for all of us. Despite these buildings being closed, our staff will be here. Staff will be here, so we'll be able to help. The third exception is actually out on what we call Municipal Hill. And that's our water customer service location. That's where people go, primarily builders, plumbers, and others, if they need water meters. That's also where we issue hydrant meters and things like that. That facility also now has a shielded point where they can do those transactions. So you'll see that. 2 main exceptions, really probably the only 2 questions I've had once we announced this yesterday. This does not affect the airport. The airport stays open. City bus will stay running, and that does include the transfer station or the transfer plaza that's here in downtown. We will take measures to use as small of a bus as we can to keep people spread out on those buses, and on those big buses, we'll be able to divvy those out and be sure we don't have too many people on there, and the people that are on are able to maintain an appropriate distance. To the extent we can, we are going to continue providing service. It's likely that some will be a bit slower, but they're not going to stop. So, for example, building permits, inspection, somebody's had to replace a water heater. We have an online customer self-service portal that's up, and information was released today to help everybody learn how to access that. Same thing with email, same thing with telephones. We have had to close, or will close, the athletic complexes, the tennis center, Safety City, our park pavilions, and the Clap Party House, and I think self-evident as to why. But all is not lost. There is good news on a couple of these fronts. The libraries will be closed for you to come in and out of the building. All 4 libraries will be offering curbside pickup for your books. The telephone numbers for that will go out tomorrow morning. Each of those branches. Basically, we're trying to give you a 1-hour turnaround. You get to us online, you get through us on the phone at the particular branch, you place your order for that book, call us when you get there, we'll bring it out to you. We will continue doing that as long as the demand is there. All the library's online resources, all of the databases, the genealogy, all of those remain up and functional for you. Adult activity centers. We have several adult activity centers in Lubbock. They, of course, will be closed for people to come and to congregate. Those adult activity centers also, though, serve to provide a senior meal program. So for those people that are registered and that count on those senior meals at lunch every day, much like the libraries, those are going to go to curbside pickup. Those individuals do not have to call ahead. We know who they are. We will publish information that if others need to sign up, they will be able to do that. There's a small number of those users to whom we also provide transportation. We will not be providing transportation in terms of bringing them to our facilities, but rather we will take the food to them. So again, this is all boxed, takeout style food. It is our same meal provider. It's just being provided in a different format. Finally, and really want to echo what Dr. Klepper said, your parks and your playgrounds will remain open. They're open. Please take advantage of them, use them. Maintain that appropriate social distance. We've added an additional protocol to clean the playgrounds, and we will continue to do that, and we'll do it on a rotating loop. Work our way around town as we do that. So those are there. We've heard in previous discussions that being outside, being in the sun, is not only just good for us, it's really good to slow down the potential transmissivity of that virus. So they're going to be there, and we're going to keep them up and running for you. To close, more information will follow. You'll see several of them come out early tomorrow morning, and we'll just continue doing that. But be safe, practice your good hygiene, your social distancing, and take advantage of what we're going to have available to offer. So with that, thank you, and I'll turn it back over to Mayor Pope.
Okay, just a couple of closing comments. It's hard for me to talk when one hand's got the microphone. I'm limited. I can't move both hands. We need adults to be adults. Nobody likes baseball more than I do. But Little League baseball teams that are still practicing right now, that's a problem. That's in violation of Governor Abbott's order, in my way I read it, and starting tomorrow at midnight. Let's make good decisions. I think Dr. Klepper said it right. Let's do the right thing. We can control this. Texas and Lubbock will not get strong again until we've worked our way through this virus, and the best way to do that is to seriously take into consideration and put into practice all of the things that we're being asked to do at a state level, a federal level, and certainly by the CDC. Okay? We can do that. That's who we are. Let's make sure as a community that we ring the bell on that. With that, I'll give it to Lacey for some questions. Ms. Nobles?
I'm going to open up for questions, but I'm going to ask you all to come to me to limit handling of the microphone.
Christy Martinez Garcia, Latino Lubbock Magazine. I have 3 questions, and the third case that was identified, I don't think there's a lot of certainty of the chronological events, because from what I understand based on Facebook, these folks traveled to Dallas and then they traveled out of the country. So when will you have the exposure locations that are a little bit more identifiable?
Right now, we are doing those investigations with 2 of our nurses have been on the phone. And an investigation isn't just contacting the case, it's also contacting the contacts and double checking information. We are concerned on travel from March 12th forward. And we will continue to interview that individual tomorrow. And if some areas of concern or public exposure, we will provide that to the community as soon as we can determine that.
And then my next question is, if someone violates this controlled order or their quarantine, are they going to be fined?
No.
It's a good question. I'll be glad to speak to it. I'm not going to focus on the fines. What we're going to focus on is understand there are 2 levels of these orders. The first level of these orders is issued under the authority of our doctors, the public health authority. That order is enforceable if it is violated. Step 2 is an order of the court. We can and will enforce these quarantines. We can ensure that whether it's the particular patient or maybe it's a close contact, we can ensure that they will stay where they are supposed to stay. There absolutely is the potential for fine and several other things that follow along behind that. But for what we're in today, that happens later. Job 1, if people have come under those orders, is to ensure they stay where we've asked them to stay, and that's to protect all of us. It's for nothing other than that. We can and we will do that.
And then my final question is, earlier today we were told that there was 6 pending cases that are still awaiting results for the virus. When will we know if those are confirmed or if they are not?
And I believe that was a statement made by the hospitals today. I have not received all of the test results I'm expecting to receive this evening. Any positive case, we will do the notification appropriately, and for any negative cases, that just goes to the doctor and they can take the individual off the isolation.
Dr. Klepper? Dr. Klepper?
Yes.
There has been some confusion among our viewers as far as if they have symptoms, using the drive-through as opposed to, say, going to a clinic. Are both available to anybody?
Both are available, but even in our case, we would rather have you call us and figure out if it's reasonable for you to come in for us to test us. We are personally at this point saying, right, if we have to test you, we'd rather send you to a center that's going to test you and send you on your way rather than potentially contaminate other individuals that may not be even associated with that. It's a natural fear to say, I've got fever, I've got chills, gosh, I'm a little short of breath, I have some asthma, let me get tested. Call us first. We can usually make some very good, sound recommendations on that. And those are not our recommendations. Those are well-documented World Health Organization's CDC criteria. Now, you're going to have the term used today was you're going to have the worried individual that wants to get tested regardless of anything. And I want to assure you that we don't encourage that. Because when this gets ahead of us a little bit farther down the road, if it sounds like a duck, it's a duck. First thing I want to tell you is you stay home. It's a duck. You may have COVID-19 just by what you're saying in your history. I don't want to see you in my clinic because I put other people at risk. I'm going to want to see you if you're short of breath and you have other things going on. So the best place is not to come in, but to call us always. The health department has extra callers. Our office, we took, it's been as you said that, in a group of 4 pediatricians, we had over 100 calls today. And guess what we brought in? None. because we knew we could get through that and tell them what was sound advice. So caution, caution. Big thing I do need to include, once again, our scariest thing, I love media, I love social media, but always consider what's social media is not what you want to take as gospel, okay? There are reasonable resources. We've all know the reasonable resources. Everybody gets tired of hearing CDC. Everybody gets tired of the World Health Organization, Lubbock Health Department, but those are reliable sources. There's no speculation. They all have your best interest in mind.
And Mayor, a couple of nights ago, we asked you about the Littlefield case, and you said that you're in contact with the Littlefield mayor. I know that's not the City of Lubbock, but can you kind of inform, a lot of our viewers are from that area and concerned about a case that might have exposed some people in Littlefield and then gone to another state. Have you learned more?
I've not talked to Mayor Turpin since that night. He promised to call me if there were changes, so I assume, and we may have some update. If you recall, that was a visitor from another state who had come to Littlefield to the correction facility or the detention facility on business. They had then, actually the system worked as it was supposed to. They did their investigation in the western state, I can't recall, maybe let's say Utah. They did their investigation. They notified the folks in Littlefield. They've been self-isolated for a period of time. I think their incubation period is very close to running. When I talked to Mayor Turpin, none of them were symptomatic, and I would imagine if something had changed, we would know. Do you know anything new about that?
Yeah, it's under the investigation of the State Health Department, so I don't have the situational awareness of that.
Before we have another press conference, I'll talk to Eric and see if I can get another update.
And you made a reference, Mayor, to avoiding social media to say that you have the illness. Well, we know that's what happened with the third case because so many people have seen that before it was taken down. So your comment now, I mean, are we not going to say where the exposure was specifically and the situation with this family connection and so on?
No, I think we are. I think what we saw on social media led us to even a more in-depth kind of investigation. I mean, so that's why it's still pending. I think if you notice, it's still under investigation, and we will run all of those traps, and that's our commitment to you. I mean, to me, I think it's probably generational, Karen, but I have a hard time understanding why somebody from the ICU in isolation would film a video to tell people that they have this virus. And you've got healthcare workers trying to help them out and all that goes along with that. And here's my concern about it. We don't need panic in our community. We want to base our decisions on facts. And we're doing our very best to communicate those to you.
But I don't understand why we don't say names. I know there's HIPAA, but wouldn't it be easier if people were identified and you'd know, oh, that's my cousin, or that's I sat next to them at an event, or wouldn't that be easier to identify where the risk was?
I know the HIPAA laws pretty well. In this case, this situation, they sort of self-reported. So that the fact that changes things a little bit, but we're going to stick with our protocol, and that we're not going to be calling people's names out.
I just had a question about how the governor's orders will affect daycares and kind of.
It's a great question. I wasn't going to comment on it unless it was asked. We just saw some guidance as I walked in the room that said it would not. We don't believe it'll impact daycare. Daycares are not schools as such in that definition, and so our understanding is at the moment is that daycares will continue to operate business as usual.
Okay, this will
Follow up on that real quick. Go to the CDC. There's a complete section that deals with daycares. It gives you specific guidelines of what daycares can do, and we're well in compliance on that.
This will be our last question.
And this is somebody on the medical side. Could one of y'all speak to the reports whether the virus can or can't be spread from people that test positive that may not show the symptoms?
I don't have, every day additional information is being reported. by the medical community. We're seeing more and more information out there, and I don't have a good concrete study that's showing that.
That's exactly true. If you would have said this 3 weeks ago, we said absolutely not. You had to be symptomatic and you would get that on. That has changed in the last week. We now know that it lives on surfaces for as long as 24 to 72 hours on hard surfaces, something we didn't think existed whatsoever. So the rate of you potentially being infected and being asymptomatic before, we can't give you a good timeline.
Okay, that's it. Thank you all for coming. We'll keep you updated on our social media channels and our website.